Hey, are you facing the prospect of having to have a hip replacement? I get it. My name is Dr. Andy Johnson. I'm a physical therapist with AJ Physical Therapy and Performance, and I'm having to take a little bit of taste of my own medicine, so to speak, and I will be having a bilateral hip replacement at 37 years old. So I'm inviting you to come along with the journey. Today, we're going to talk specifically about my prehab or pre-surgery game plan going into surgery from a fitness and physical therapy standpoint. So we are going to meet with Dr. Jeremy Wampler, physical therapist, who is going to be in charge of my prehab. Let's check in and see what he has to say.
So my name is Jeremy Wampler. I'm a physical therapist, and my role in Andy's journey is to help get him better after his hip replacements. Not only that, I've also been working together before his hip replacements. We call that prehab, rehabilitation before his surgery to allow him to be in his most optimal condition coming right out of surgery. As far as goals prior to surgery and what we should be focusing on, when we get surgical patients that come out and they're really, really stiff right before surgery, they're going to come out really, really stiff after surgery. And already we are at a disadvantage because after surgery, everything stiffens up. We get a lot of swelling. So if we can get someone mobile within their tolerance, meaning we're not just going to blast them into a ton of painful positions, but we can get them moving better, I think we have better outcomes after surgery, getting them back to moving. And so movement is the foundation or the start. If we look at strength, the same thing applies. If we can get them stronger before surgery, then after surgery, we think they'll have a better rehab process. They'll come out with a little bit more ability to get their strength back faster. So I think that when you talk about Andy, it's hard to describe his weaknesses because we'd have to name all the muscles in the body. But is that part of the video? All right. Now, some of the biggest things is his hip strength, and really talking about the gluteal strength, but not only that, his ability to feel and utilize the right muscles. So for example, when he was doing some of his single leg squat type motions, he was utilizing his quadriceps on his right side, especially more in his glutes, and those gluteal muscles surround our hip region, and they're very important to giving a good support system to that area after the hip surgery. So gluteal not only activation but strength is going to be a big focus for him. And obviously we want his whole lower extremity to be strong, but that's the reason we're going to combine some kind of compound movements, and compound meaning we're using multiple joints at the same time. So he was doing single leg squats as an example. So he's getting his quadriceps, his hamstrings, all of his glutes working at the same time. Range of motion wise, Andy was very limited. I don't have the data in front of me actually, but his hip rotation was pretty limited. Multiple directions, meaning his ability to rotate internally or externally or out or in was limited. He also had some limitations in his ability to flex his hips. So if you think about flexing or the knee moving towards the chest, that was limited. So this is going to limit his ability to do things like sitting, or if you're talking in the gym, even squatting or those kind of positions. So he also had a limited hip extension. So that's your ability to bring the hip behind you or extend it behind your body. And we need this even day-to-day functions with things like walking. Our hip needs to be able to extend behind our body. If we can't extend it, it may lead to compensations and problems. So Andy, he has some symptoms that have gone down his leg at times, and so we did find some what I refer to as neurodynamic deficits, meaning that nerve system is a little irritated at times and he's getting sensations down his legs. So when we tested, sometimes we can feel like we're just tight in the muscles, but the nervous system may actually be sensitive or tight itself, and we found some of that with that sciatic nerve area that goes down the back of his leg. So we're going to be adding some specific stretches for that nerve. One of the differences you'll notice is a lot of times with stretches, we may hold the position in the stretch and just sustain that stretch. We call that a static stretch, but we're going to be more dynamic with nerves like movement, so we're going to be oscillating off and on the stretch.
So as a physical therapist, I understand the success rate of a hip replacement, but I'm human, I still have some doubts. So I asked Jeremy if he had any doubts for me coming into this. Here's what he had to say.
It's been bothered, and it's gotten to the point where you can't, you can't do the activities you want, right? So when you get to that point, you are a candidate. We know that structurally you are a candidate. We know that you can't do the things you want. So if you could do the things you want, why would you want to do surgery? Or if it's not that bad, why would you want to do surgery? So I think you are a candidate in that sense. And not only that, I know that the hip, I've treated so many of these for years and years and years that I know that the results are going to very, very likely be very good with you. And the rehab process of hips is a lot better than a lot of surgeries. Is that on camera?
Okay, so let's recap the goals with prehab. Okay, so goal number one, really most importantly, was to get some baseline measurements, baseline strength, baseline range of motion, and any other factors contributing. That way we have some objective measurements to compare to when we get into post-surgery rehab when we get to that point. So that was goal number one. Goal number two is we wanted to address the adverse neural dynamics that you heard Jeremy mention earlier. This is a kind of an external factor, not necessarily related to the hips, maybe indirectly, but I definitely don't want that nerve to be flared up right after surgery. And so we want to make sure we're going to do some corrective exercise stuff to try to mitigate that just as much as possible. So hopefully that won't be a problem in my early rehab after surgery. Number three is we want to maximize my strength of the muscles around the hip joint. You heard Jeremy mention some of the exercises I'll probably do, but the goal is to get it as strong as possible without making it angry at the same time. So we have to tread lightly a little bit there, but we do want to get these muscles strong, especially those hip abductors or the glute med. We want to make sure we're activating well there, because we always see after this type of surgery, that's a really hard one to get going again, so we want to get it going. Number four, I'm also going to be working on maintaining and possibly even gaining a little bit of flexibility around that hip joint and the muscles connecting to that area. Again, keeping in mind that we don't want to make it too angry. I know, because I've been working on this a long time, if I push a lot of rotation range of motion, which is where I'm very limited in the hip joint, I tend to just make the hip angry. So I'm not going to push the envelope with that. But there's still some things I can stretch as far as hip flexors, hamstrings, a little bit into the glutes to try to maintain some range of motion, but hopefully without making the hip joint too angry, so I'm as flexible as possible going into surgery. Hey, thanks again guys for watching. Hopefully you found some value in these videos. Please stay tuned for the next one, because we're going to meet with a registered dietitian to go over what the game plan is from a nutrition standpoint for me leading up to surgery, immediately after, and the following months after. So looking forward to that one. Make sure you stay tuned for that. Please hit the subscribe button. It really helps us reach out to more people. And if you have questions, comments, concerns, please leave it in the comments below. We would love to hear from you, and we'll try to respond to as many people as possible. Also, check out the description. I'll have a couple links in there for you as well that are hopefully helpful to you. In the meantime, we'll see you soon.